Hi there.
Hello, my name is Victoria Wright. I'm an oral facial myofunctional therapist. My business is integrative myofunctional therapy in San Diego County. I named my business integrative because we have a whole body approach to our treatment.
And I'm Dr. Catherine Dahl. I'm a doctor of orthopedic manual physical therapy. I've been in practice for 30 years, and for the last 12, I've owned my own business called Fusion Therapy here in San Diego. Fusion therapy is a combination of both Eastern and Western philosophies, and the Eastern involves Chinese medicine and Ayurvedic medicine so that we treat the whole body and the whole person.
We're here today to introduce a wonderful book called Routine for TMJ by Annie Coombs, who's a licensed massage therapist and cranial sacral therapist. I was introduced to this book at a conference, and it has really become a good tool for my patients, but we're here today to actually demonstrate the techniques of the massage for your benefit.
And just know that while we were inspired to help the patient utilize this book at home, it is not meant to stand alone. And please try to remember that if you do have any kind of temporomandibular joint pain or headaches or neck pain, that you want to seek out a therapist or a doctor if that's specialty in order to get the right team approach for treatment.
Hello, today we're going to demonstrate the 5 muscles that are associated with the temporomandibular joint. The masseter muscle, the temporalis muscle, the digastric muscle, the medial pterygoid and lateral pterygoid muscles.
And there are going to be 3 basic techniques that will be discussed. And the first one is called stripping. Stripping is just following a muscle longitudinally along its fibers, sliding over the muscle. The next is trigger point, and trigger point is where you find a nodule or a tender spot in a muscle and you stay on that and you hold it. Ischemic compression is where you hold it long enough until the patient's pain dissipates or you feel the tissue soften under your fingers. And lastly, there's a technique called skin rolling, and that will be demonstrated just slightly here today. There are some differences in techniques between different practitioners, but we thought we would include it since Annie Coombs put it in her book, and you can refer to her terms at the back of the book for that more specifically.
She has a complete glossary at the back of her book, which I highly recommend that you own your own copy of the book, either hard copy or electronic copy, in order to really take advantage of these techniques on yourself.
And one other technique that she doesn't mention much, she mentions it once I think in the book, is called cross fiber technique, and that just means going perpendicular to the muscle. So we'll include those again as we go through each technique as I demonstrate on Victoria today. Welcome back. So this is the first of our techniques showing on the masseter muscle. The masseter is a clencher. So if I have Victoria just lightly clench her teeth together, you can feel from the side of the jaw that muscle tightening up, so you know that you're on that muscle. It runs from the cheekbone down to the bottom of the jaw and generally angles a little bit back. That's the superficial part, and then there's a little tiny deep part that is more vertical. Nothing that you have to worry about specifically at home, but just for those of you that are more interested in the anatomy. So now I'm going to do the first technique that's called stripping. Stripping, you're going to start either from the top or the bottom, but I like to start from the top on this muscle because it goes better with the skin on the face. And it's okay to start from the bottom, but then you get a lot of skin pulling with it. So I like to start from the top, and I believe Annie Coombs talks about going from the bottom. But again, it doesn't matter as long as it's comfortable to you or the patient. And if you're doing this on yourself, obviously you're not going to hurt yourself. You're going to make it feel comfortable. So I have a moderate amount of pressure. You can start light and just follow that muscle down and think of those different angles of those fibers. And while you're doing that, you can kind of assess to see, do I feel a little spot in there that might have a little more tension? Here on Victoria's left side, I do feel that, but I'm going to show you now transitioning into a trigger point holding, where I find that spot and I say, oh, now I'm going to hold this spot, and I might just circle a little bit on that spot, and I might put a little more pressure there until I feel, is that softening? And if I feel it softening, then I can move on. And if it's tender, but you don't feel a hard spot there, that's okay too. Stay on the tender point and hold. And that's trigger point releasing. You could wait till a pulsing happens under the finger. You could wait until the pain dissipates. Perfect. And as we come down, as we're going to move on to another technique, that's going to require a glove because I'm working on Victoria. When she's going to do those next parts herself, she won't need a glove. So starting at the cheekbone.
And using 2 to 3 fingers, depending on the size of the hands.
Good, and then you can angle a little bit backwards since this muscle has a tiny bit of a backward angle from the top to the bottom. Great. And then after stripping, if you find some spots in there that were extra tender or a little nodule tight fiber, you could stay on that. And you could use the pads of your fingers. Also be careful not to use tips of fingers with the nails. You never use the nails, you always use the pads of the fingertips. And again, you can hold and you can circle that point. Okay, now I'm going to put on a glove and go inside the mouth. So I'm going to go intraorally on the masseter muscle here. And I'm going to just find the temporomandibular joint with one hand and stabilize the forehead. And then I'm going to have Victoria open and I'm going to slide in along the side of the cheek. So when you do this yourself, obviously you don't need a glove when you're doing it on yourself. And then just relax the teeth and let them kind of come together lightly. You're not clenching, but you're in rest position of the jaw, which when you get some treatment from somebody who knows what they're doing, they'll teach you that. Tongue along the roof of the mouth. Okay, so now this, I've got the masseter muscle here and I'm pinching between my thumb and my fingers, my index and third finger, and I'm going across the muscle. So this would be the cross fiber technique. And if you're not sure you're on it, have your thumb out of the way from the teeth, and Victoria, I'm going to have you lightly clench your teeth together, and I can feel that muscle right here clenching. Okay, then relax. Now again. And from this position, I could do stripping up and down like we did before, or I can do the cross fiber technique. And again, if I feel a hard spot in there, I can come along there and hold that spot and literally just keep it there until I feel that muscle soften or the tissue releasing and the pain going down. And that would be indicated by the patient raising her hand. There we go. And now I'm going to have Victoria do that on herself. Okay, Victoria, so you're going to take your opposite side hand, so the left hand's going to go on the right side cheek and go along the cheek on the outside of the teeth with your thumb. Yep, and then you reach back toward the ear, the jaw's in front of the ear and the masseter muscle's just in front of that. And again, you can lightly, as long as your thumb's out of the way, clench your teeth together a little bit to feel that muscle tensing between the fingertips, and then relax. And then you can do the cross fiber technique where you go from the back to toward the front of the muscle horizontally. And this should feel really good. This is very helpful for most patients. A lot of people are clenchers, and this is very relaxing and often relieves pain.
Feels good.
Perfect. All these techniques you can do as long as you need to till you feel some relief. You can anywhere from 3 to 5 minutes. The temporalis muscle runs from a point about 1 inch in front of the ear. So if you find the ear and you come about 1 inch forward, there's a point there that the tendon attaches to. And then it runs upward in front of the ear, and it fans out over the ear to the back part of the skull behind the ear. So in order to do stripping on this muscle, we're going to start on the muscle fibers, not on the tendon. We're going to be here and we're going to come and strip upward. Try to sift through the hair a little bit to get to the scalp. That muscle is within the scalp. And I'm just going to follow those fibers, stripping them. And as they come to the middle, they angle a little more backward. And into the back fibers, they run more horizontal. And as I'm stripping, if I find a point that I feel is a little thicker or more nodular, I could stop there and do a little cross fiber work, which means I'm going horizontal to the muscle fibers. So here I'm hitting more of the back fibers, and they're running more like this, so I'm going up and down with my cross fiber technique there. And then as I come forward, if I find that thick spot and I want to hold and do a trigger point release, I can just keep my hands there, my fingertips, and let them rest in that area until I feel the little bit of pressure as that tissue gives. Or I may feel pulsing, or the pain that the person feels. If you're doing this on yourself and it gets less pain, then that's great. You're having an effective technique. Okay, so that's the 3 techniques, and now I'm going to have Victoria do this on herself so that you know how to do it at home. You're just going to use your fingertips, index and middle finger. Okay, Victoria, so 2 to 3 fingers coming up along in front of the ear and up towards the temporal area. Just following that muscle. The front fibers, they angle a little backward and back behind the ear. Good. And then if you find a spot that you find is extra tender or has a little thickening there, you can hold for your trigger point release, or do some cross fiber where you move perpendicular to the muscle fiber. Just think of going across it. And then those, you don't slide as much across the tissue, you just kind of hold on the tissue and go a little bit up and back. Yep, just like that. Good. Perfect. Okay, so now we're going to go intraorally for our technique on the temporalis. And I'm just going to show here in the video, we're about 1 inch in front of the ear. And that's on the outside, but going in, I'm going to use my pinky and I'm going to have her open and I'm going to slide along the cheek outside of the teeth until I feel that point where my outside finger is showing, okay? And to feel it a little better inside, I'm going to have you open and close lightly. Yep, perfect. Just a little bit so I feel that point coming into my pinky. And if you look closely, go ahead and stop moving there, Victoria. If you can see my pinky kind of pushing out, that's not the point of it, but now I go up and under here. So I'm a little bit forward of my hand. Right there are the 2 that they're meeting. Okay, so now with that, I find that point, and one of the techniques is to just do a little circular pattern. You really can't strip it as easily because this is just a small little area inside where the tendon is attaching to that point. But as she opens and closes, go ahead and open and close. That can be part of the technique where I just hold my pinky there and it's bringing the bone and the tendon into my pinky. And that's a release technique for the temporalis where it attaches. Perfect. And then if I'm going to have Victoria do that herself, Victoria, I'm going to have you do this on yourself, and you're going to open and slide it along the side of the cheek outside the teeth. Perfect. Come back until you now open a little bit and close a little bit till you feel that bone moving into your finger. You could use your own pinky, you could use your index finger. We're showing it with the index finger here. Yep. So you just feel this little point coming into your finger, and then you can relax and hold it there. And as you hold, you're looking for a release or pain to decrease as you're doing the technique. And again, this could be 30 seconds to a minute to 2 minutes. Good. And that's it for that one inside the mouth on the temporalis. Okay, the digastric runs from the chin straight back to this little bone that when we swallow you can feel it move up and down. It's called the hyoid. And it loops underneath there and runs back to the mastoid process of the skull, which is just a knob on the back of the skull behind the ear. Okay? So from the chin, there's this little tiny muscle, and they're in pairs like this, right next to each other, from here back. And look, that's only about 1.5 inches, 2 inches, depending on how big the person is. And if you want to feel this one work, if you just open slightly, good, and then if you swallow for me, you can feel that muscle working, and then you'll know you're on it. And then as you come back behind the ear to that little knob, and I'll show you a little bit more here, there's a big knob on the end of the skull right here behind the ear, and that's where that muscle attaches. So when we're going to strip this muscle, I go from the front to the back. So you're coming along the front. This is called the anterior belly, or just the front part you could think of the muscle. And you're just stripping vertically along the fibers in the same direction as the fibers run. And then to come back, I'm going to do one side so you can see this. Come under, almost like you're under the jaw, and then you come straight back to that bony knob on the skull. So that's a stripping technique. And if along the way I feel a little spot that I think is a little tight, more tight than another spot, I'll hold there. And that's your trigger point release. Or you can go across the muscle. And remember, it runs longitudinal or up and down like this. And so you're going to go across it this way. And I can do the same for the back part of it. Swallow for me. Good. And then again, I could feel, yes, I'm on the muscle. And I can work that muscle. Okay, and then I'm going to have Victoria do that on herself. Okay, so Victoria is going to demonstrate this on herself now. And you can use either your thumbs or your fingertips. Let's start with the fingertips and go in from the chin back or down, really, to the hyoid. And so the hyoid ends right at the bottom of the jaw, basically in the chin area where it meets your neck. And if you were ever curious of if you're on the right spot, then you feel it on yourself and swallow, and the bone actually moves up and down. So that's the front part of the muscle. Again, it's a little short thing, just about an inch or 2 inches, about an inch and a half to 2 inches long. And then if you find any spots in there that you want to hold, you just hold the thumbs there or the fingertips there on those spots. And this is a really important muscle for swallowing. A lot of people with temporomandibular joint problems, they have trouble swallowing, have some speech difficulties sometimes, have pain in this area. And so it's very important because it also, not only for swallowing and breathing, but it comes back to the base of the skull. So let's turn a little bit and we'll go to the back part now. So that again loops under the hyoid and runs back to this knob on the skull back here. So you can strip along there. Great, and if you find a spot that's more tender, you can hold there. And again, you can do a little circular motion up and down across the fibers of the muscle. If you're ever getting stuffiness in the ear or pressure in the ear that won't release, a lot of times these types of techniques on these muscles for the jaw actually help that. When people also have ringing in the ears, it helps there too. Good. Okay.
And also patients don't want to put their head too far back.
Right.
When they're doing this particular massage technique.
Yeah, if you want to accidentally tip the chin up because it's hard to get to that muscle otherwise, but just watch out if you have any neck issues. Try not to tip your head back too far because that could cause a little irritation in the back of the neck. Okay. Okay, to go intraorally, it's optional, but if you don't mind being underneath the tongue with your fingers, I'm going to have Victoria open. I'm going to have her lift her tongue, and I'm just going to lightly come down. Now, you don't need to press hard or anything, and I'm kind of supporting her underneath. And I'm just going to think that same thought process of stripping that muscle from front to back or back to front. And know that you're going through other muscles under the tongue. There are other muscles here. But basically, you can feel the fingers from outside to inside. So you know it's a thin area, but there are multiple layers of muscles. And this can really help release some of the tension with temporomandibular joint dysfunctions. And the stripping, and again, holding in a point, cross fiber, would be back and forth this way over the muscle. And if a person has trouble opening this far, you can release just a little bit. You don't have to be quite as open. They don't have to be holding that far open because a lot of people with these problems can't or aren't comfortable opening their jaw that much. Good.
So this is an additional exercise we use in myofunctional therapy in order to help the body separate the floor of the mouth from the tongue.
And she's just working around that area, just like we did from the outside, but think of being inside and visualizing that muscle inside. Good. Okay, we're going to move on to the medial pterygoid. And this works in conjunction with the lateral pterygoid it's one of the muscles of mastication for chewing. And so it's very important in temporomandibular joint dysfunction. And I'm going to show, let's see, I'll show here on this side, then I'll turn and we'll show the other side. It's under the corner, what we call the angle of the mandible, or let me show you here on this side. If you come back to this part of the jaw, the very back of your jaw, it's underneath that. So on this one, you have to kind of sneak underneath it. And this is what Annie Combs refers to as skin rolling. She comes up underneath and just rolls the finger back here, okay? And I like to scoop a little bit, but again, not with my fingertips where my nails are, but at the pads of my fingers. I use 3 fingers and I kind of come in, and it ends up being like the 3rd front and the 4th back behind it, like that. Can you see that good? Okay. So this is actually very tight on a lot of people. And so you want to be careful not to dig in and cause any pain. There's also the carotid artery here behind you, so you have to be a little careful, or behind where your fingers are. So you have to be a little careful. But it's very safe technique all in all, and you just want to stay right under that angle. And just start gentle. So as far as stripping, it's hard to strip because this muscle is running deep into this part of the skull that's inside the mouth. And so you're just at the corner edge of it. So mostly you're just doing a cross fiber technique on this muscle or a trigger point hold. Okay, and as it loosens up, you'll be able to slowly get under the jawbone a little bit better. Otherwise, it feels like you're just kind of barely getting anywhere. But as it softens, you'll get underneath the jaw more and more. Okay, and that's the outside approach to the medial pterygoid. And we're going to go inside next, but I'll have Victoria show how you would do it on yourself. Okay, so Victoria is now going to take her opposite hand, the left hand, to come to the right side medial pterygoid, and you're going to come horizontal or in line with the bottom of your jaw and slide up underneath it. So see how she's trying to get up under the bone, so you're on the inside of the jawbone. Exactly, and that muscle is running from the inside of this jawbone inward towards your mouth. So you're just getting the corner of it as it attaches out there. Good, and so you can cross fiber it or hold. And if you're not sure if you're on it, if you get there and then just lightly clench your teeth together, and you should feel it because it's a closer of the jaw. It's also moves your jaw to the opposite side. So if you're still not sure, you can move a little bit towards your left with your jaw, and you could maybe feel that muscle there as well, contracting. So then again, you know you're on it. So those 2 techniques, great. Okay, to go intraorally or inside the mouth for the medial pterygoid, I'm going to use my pinky, and you too, when you do it on yourself, you're going to open the mouth and you're going to slide along the bottom of the teeth straight back. I'm going to move my hand just so you can see I'm behind the teeth, and you'll feel a band, like a fibrous band that goes you'll feel from the top teeth down to the bottom teeth. So I'm just pivoting my pinky up and down for a stripping of that muscle back there. And some people have a big gag reflex, so you want to be really gentle with this at first and just lightly stroke it, okay? And if you feel a little tight spot, then you can hold right there. If you're not sure if you're on it, you can gently clench your teeth together, but be careful. Like with my finger, she can come around my finger a little bit and lightly clench, and I'll feel that muscle tighten up. Good, and then relax. And then I can know that I'm on it, and I can do a trigger point hold. And there's no real cross fiber on this muscle in this position, but just moving more of the stripping, like a C motion inside the mouth there at the back. Okay, so now Victoria's going to do this on herself to get the medial pterygoid inside the mouth. She's going to open, slide the pinky back along the bottom teeth, and when you hit the little flesh that's right behind the teeth and go up and down from the top teeth to the bottom teeth, that's the medial pterygoid. And she's just stroking there, kind of like in a little bit of a C motion. And you can hold a little bit and just keep the finger still, almost like a trigger point release or ischemic compression. Good. And that's it. Moving on to the lateral pterygoid. This muscle is very important with temporomandibular joint dysfunction or jaw pain. If you have any jaw pain or clicking, this muscle could be the culprit. Palpating from the outside, you go in front of the ear, and this is the jaw joint. And remember that one point we found before with the temporalis. In between those 2 points of the bone of your jaw, there is a point where you can get back into the lateral pterygoid. Now you're going through the masseter to do this, so you'll feel other muscles, but if you get on that point, you can just do a little bit of circular work or cross fiber work right here. Okay, and what I like to do is go from the fourth, the third, and the second fingers are here lined up and be the third finger in this little divot that you're working on. Okay, and that is the lateral pterygoid from the outside. Okay, so using your same side hand, if you're on the right side of your jaw, using your right hand, do the 3-finger technique to see if you can feel that you're on it. You want to be on the joint here with the index, middle would sink into the divot, fourth would be on that front point we talked about before with the temporalis. So then the middle finger, again, is over the masseter, but underneath inside the jaw is this lateral pterygoid there. And so you can hold, you can do little circles, you can do cross fiber technique. There's no way to really do stripping because you're not getting enough of the muscle to strip the whole fiber direction. Good, and that's it for outside. Okay, for Victoria to do this on herself and for you to do it on yourself, you're gonna use your pinky and you're gonna slide along the top teeth and you go right straight back behind the teeth till you hit flesh, and then you move to the outside and up a little bit. And right there is the lateral pterygoid. Just gently start and see if you can let your finger be there, and then if you want to check it, you can just open your mouth a little bit. You'll feel the muscle contracting into your finger. Or you can gently move your jaw to the opposite side, so you can move your jaw to the left if you're on the right. And with this, you just be really careful and gentle with yourself because these muscles are often in guarding or in tension, under tension. And you could hold there, you can stroke there a little bit. Perfect.
So that concludes our demonstration of the exercises in Annie Coombs' book, Routine for TMJ. And at the back of the book, there's a complete glossary of terms that go into a little more detail than we discussed today. I recommend that you get a copy of the book for yourself because there's more information than we were able to cover. In addition, there's also a bibliography or resources in the back of the book if you want some more information on the validation of these techniques. And in addition to that,
I added 2 research articles there that are just referenced in case you do go to the doctor or a therapist and they have and more interest in it, and you know that there is a controversy in our field of whether or not you can actually touch the muscle that's the lateral pterygoid. Thank you.
Thank you for joining us.
Appreciate
We
your
hope
time.
this helps.
Hope it helps. Bye-bye.
Bye-bye.